How common is it for people to be turned away or not be able to find care?
I guess I can only answer these questions from what I know and what I see, but it's an everyday event. It's very common. I mean, there's so many reasons that people can't access care, whether it's, and one of the students here had mentioned logistics or where they're located. There may be not dentists in the area that can provide their care. It could be financial, which is probably the predominant one, or in our case, we have medical and behavioral issues that preclude people being able to do it in the routine way. But a lot of those things just leave people without anywhere to go.
How would access differ among different age groups, such as kids, adults, and elderly?
The one thing that I've seen here is that, at least in the Gainesville area, Gainesville's not an affluent area, but at least in this area, most of the kids seem to have access. And I think it's largely because of places like U of F College of Dentistry and some of the other things that do take some of the supplementary reimbursement systems. But it does still come in all the time in our pediatric clinic that we have kids come in all the time with early childhood caries, and these little things just snowballed and got really bad. But even with the traditional Medicaid, if you're looking with the state reimbursement, Medicaid at Medicaid rates did provide for most care for children. Traditional Medicaid pretty much cut off most services at age 21 though.
So, and among those with mental and developmental disabilities, what is the biggest barrier that they specifically face?
People with those kind of disabilities present with many different manifestations of that. And and we have students that come here in our clinic, and we have residents that come here in our clinic, and what I hope their biggest takeaway, I guess, is don't presume how it's going to play out. I mean, if you give it a try, you'd be sometimes surprised at what you can accomplish, but a lot of people are intimidated. You hear a phrase, disabled, or maybe a specific disease state, or and think, oh, I'm not a specialist, I can't do that. Well, you don't always have to be. And if you're willing to just give it a try, you'd be surprised how much you can do. And if you can't, then hopefully you'll be in an area where you could find someone that maybe could. But a lot of people just continually just keep hearing from practitioners, we don't do that here, we don't do that here.
What would you recommend to new and upcoming dentists what to do in that instance?
Well, at least be willing to give it a try. Now, by law, the Americans with Disabilities Act states that you can't deny people access based on the fact you have a disabling condition. In fact, just recently, one of our other faculty, the former dean at the College of Dentistry, Dr. Catalanato, has been showing me some things that the the American Dental Association is trying to incorporate that phraseology into their formal code of ethics. I think it's always been assumed that it would be done and adhered to, but they're trying to make it more apparent that we as professionals do have some obligation to try to achieve that standard.
And then you touched on economic and geographic barriers. Did you want to elaborate on that at all?
Just as we were here talking, we were talking about sort of geographic barriers. We looked at a map of Florida and found that there's actually one county that has no dentist, and many counties that have one dentist, and some counties that have hundreds of dentists. And there's an interesting distribution of a lot of dentists in Florida. So some of those far to reach, hard to access areas, they don't have dental care easily available because there aren't people nearby. I don't know how to fix that.
So how do you think dental students could be educated or trained to better serve individuals with disabilities?
Okay. Recommendation would just be willing to try to be willing to be flexible. Again, I think you'd be surprised what you could get done. Sometimes it's a push, and sometimes you gotta actually be really creative to get to the end result of whatever it is, and that's probably the most fun part.